Hello everybody, welcome to the online class. Today the topic I want to share with you is the practice of differential diagnosis. In the country I received my training and the country I'm practicing now, physiotherapy are allowed to practice direct access. That means patients can consult physiotherapy without a doctor referral. Therefore, screening is more important, okay, because we need to confirm whether the condition we can handle or we need to send it out. Before I start, please allow me to share some experience of my training. My master training was conducted in University of South Australia, which is in the city called Adelaide. In this city and in this university, there are two very famous physiotherapy I want to introduce to you. He is called Mark Jones. He was the program director and one of the instructor in my master training. His very specialty is clinical reasoning. Okay, I will explain a little bit more to you. So maybe later you want to search his information for a little bit. The other one I don't need to explain too much is Jeff Maitland. He was born in Adelaide and conducted in teaching most of his career there. So he just passed away 2010, the year I received my master training there. So for Mark Jones, if you don't know him, I can tell you he did a lot of publications about clinical reasoning, especially one textbook he contributed was the clinical reasoning in the health professionals, a physiotherapy who teach the clinical reasoning to other health professions. So you can imagine how experienced he is in this area. But I had to emphasize that the training in University of South Australia was like the hell. Okay, was really tough. If you want to attend the training there, please be prepared. Okay, really tough. And in the training, it was emphasized a lot about differential diagnosis. Some of our lessons were even conducted by medical practitioners to teach us how to do differential diagnosis. You can see how much they emphasize on this. And one clinical reasoning approach I practice the most is called clinical pattern recognition. It is a very famous paradigm. Okay, maybe you can Google a little bit later. Because using this paradigm, not only musculoskeletal conditions, even clinical condition, medical conditions, you may be able to screen it out through this clinical reasoning approach. So today the lesson is very simple. Let's do some practice and exercise, and then in between you can pause the video to think or to write something, and at the end I will give you the answers as well. Please try to practice it yourself. So the first practice, groin pain. Okay, first I need to clarify with you that groin pain is a little bit different from hip pain. Groin pain means the pain is on the inner side of the thigh, which may touch the pubic area. So you know the hip joint very seldom touch the pubic area. So if a patient comes to you to complain groin pain, okay, you try to think three possible hypotheses for. So can you try to think about it? So you can pause it and practice it before going to the next. Second one, chest pain. As you may be aware of that, chest pain is a very alarming sign for us because you think some threatening condition like your heart and lung conditions, but according to the statistics, close to half of the chest pain can be musculoskeletal origin. Okay, could you differentiate between heart problems, lung problems, and musculoskeletal chest pain? So arthritis, you definitely may be familiar with arthritis as one of the major scope of practice in musculoskeletal conditions. Okay, but beside osteoarthritis, if a patient complain joints pain and come to you, maybe multiple joint pains. Okay, so could you try to do differentiation for 4 different types of arthritis? It's a little bit difficult, but have a try. First, I will give you the answer later. So practice 4. Okay. If a patient comes to you and present this sign and symptoms to you, either on elbows or on shoulders, they are middle-aged men. Okay, what is that in your impressions? The typical symptom, some inflammatory sign, but not very painful. Okay, think about it. Okay, so now I'm giving you my suggested answer. You may agree or disagree with that. Okay, just have a look. So first, groin pain. Okay, at least 3 major differential diagnoses we should have it in our mind. First is the adductor strain. Okay, since the fibers of the adductor origin attached to the pubis area, it can cause groin pain, typical groin pain. Second one is the inguinal hernia. Okay, it happens more in young adults. No matter male or female, it's a medical conditions due to weakening of the inguinal abdominal wall, and then the internal organs is squeezed out by the internal pressure. Okay, it is a quite if it is acute conditions, quite a serious medical condition, send them off. Of course, you can say also the other women health condition as well, maybe. And one more is the osteoitis pubis. Okay, it's the inflammatory condition due to overuse, continuous rubbing and shearing force acting on the pubis surfaces. Of course, musculoskeletal area we can treat. So for the chest pain, okay, first we are quite aware of heart. Okay, any angina, okay, shortness of breathing, okay, numbness and referral pain to the lower chin and the left shoulder, send them off immediately. Even the symptom may not be that typical and acute if the patient does not have any previous threat up to the heart. Okay, I do suggest that. Do a ECG or blood test. And then lung condition, beware of pneumothorax in the young adults. Others condition besides chest infections or injury, lung condition usually goes with breathing difficulties, coughing, okay, any breathing pain, okay. So send them off is such kind of conditions. But you will find that the most challenging thing is that the patients come to you that they already received screening from the medical practitioner to screen out heart and lung conditions and consult you chest pain. Then what ideas you have in your mind? Yeah, there is a very famous condition, T4 syndrome. You should know that because a T4 syndrome, I need to highlight that it is musculoskeletal T4 syndrome. And you Google search a little bit, you can find another called T4 syndrome. Is due to the secretion of from the thion. Okay, it's a kind of metabolic conditions. So two have the same name, but they are different. And also very simple, straightforward costosternal syndrome or costochondritis. Okay, inflammatory conditions or just painful condition in the ribs and vertebra of the thoracic segment. just highlight a little bit. T4 syndromes is quite a typical one. Why they have the chest pain? Just simply due to the dermal tone distribution of the thoracic spine, and also it's so-called T4, but it's not limited to T4. Even T3, 4, 5, 6, we can just include them as T4 syndrome. So practice 3, arthritis. Besides osteoarthritis, do you have anything in your mind? Of course, rheumatoid arthritis. We know that well. The typical cues of diagnosis that bilateral, more female than male, happens more frequently on the distal joints rather than the proximal, especially deformation on the fingers are very typical. Okay, blood test is not the only test. Remember to confirm diagnosis, the diagnostic criteria is the main criteria. Second, systemic lupus erythematosus, more happening in female. Okay, especially if the at the moment they have a significant fluctuation of their female hormone, just like pregnant, and the typical symptom is the butterfly-like rush on the face. Okay, then you should never miss that. This psoriatic arthritis, more common in men, and this typical symptoms the mechanism is due to infection, but typical symptom you should never miss that is on the skin. They have silver-like skin rash. Okay, this is not uncommon to you, but maybe you may not be aware that it also causes arthritis. Okay, psoriatic arthritis. One is reactive arthritis, also autoimmune problem and systemic problems. If I need to say the typical mechanism and features, because the mechanism was due to infection involving the GI tract. This the main arthritis. The patient may symptom with the stomach problem like diarrhea, stomach upset. Okay, and I would say the severity of this disease is quite significant as well. Yeah, be aware of that. So the last one, I just simply give you the answer. The left side is the CPPD, calcium phosphate disposal syndrome. You can call it pseudo-gout. And when I say that, you may correlate to gout, which is on the right side, very typical. This is due to diet and renal failure. Okay, it happens more on the big toe for guys, gentlemen. But pseudo-gout or CPPD is due to the liver dysfunctions due to excessive disposal of calcium phosphate crystal. Main features that they happen more on elbows, shoulder, upper limb, and also the severity is not as much as gout. So some people may miss that because not as painful. There are some debate that whether physiotherapy should focus mainly on physical diagnosis. We are not medical practitioner. Okay, medical diagnosis is not our main expertise, but I just think not only physiotherapy, even nurses, occupational therapy, dentists, whatsoever, medical diagnosis is definitely helpful to screen their patients if we practice direct asset. I have few very nice textbook recommend to you. The first one is called 100 Cases in Orthopedics and Rheumatology. Very simple, straightforward. There are 100 cases to guide you how to do the differential diagnosis, clinical reasoning by orthopedics. Yeah. The second one you should know well is our so-called Bible in sport medicine, clinical sport medicine, Berner and Kahns. Yeah. And the third one is the differential diagnosis for physical therapy, screening for referral. This one mainly focus on the differential diagnosis and screening, but not as much in management, because we believe that we should do no harm to the patients first. They are very good. So this almost the lesson just I want to share with you. If you have more interest in differential diagnosis and want me to make more online class, please feel free to suggest to me. And thank you very much. Bye bye.